Hi, I'm Kristen Palmer, and thanks for joining us today for Healthy Living at Pinehurst Surgical, joined by Ray Washington. Welcome.
Thank you.
Thank you for coming on the show with us today.
Absolutely.
And Dr. Washington has been at Pinehurst Surgical now for 9 years, and of course this wonderful state-of-the-art facility that you guys have been in now. How long?
We've been in here a little over 3.5 years.
Yeah, it's hard to believe, but it is beautiful, and boy, you can get head to toe in this place.
Oh yeah. We've got plenty of people here to show you around though.
Right, that's right. Well, Dr. Washington is a general surgeon, but you are today focusing on a specific surgery called the lap band?
Absolutely. The lap band is a bariatric procedure that we've been doing here for 4 or 5 years, and it's a minimally invasive surgery that people have done very well with. Explain
why a person might choose that over the more invasive surgery.
Well, the traditional gastric bypass really changes your anatomy, and it works very well at weight loss, but a lot of people either don't need to lose as much weight or not so much worried about having their anatomy changed. And it's a way that we can put in a little small ring that goes across the upper part of the stomach to help people lose weight.
How does one sort of get into this program?
Right, so you really need to be defined as being overweight. So ideally somebody about 100 pounds over their ideal body weight would be a candidate for surgery. Usually we also look for some comorbidities. A lot of patients that are morbidly obese may have hypertension, diabetes, sleep apnea, osteoarthritis. So we'll look at some of those things in conjunction.
Okay. If someone is interested, and I mean, I guess we're hearing more and more in the media that those things do come along with being really overweight, and it is something also that in society is so tough for people to deal with. But I know that emotionally and psychologically they kind of have to go through a profiling to make sure that they're going to be ready for the program.
Absolutely. Really, weight loss surgery is an opportunity to lose weight and regain some of the health status that you may have lost. We have all of our patients go through an extensive evaluation. We have a psychological evaluation. We also have a patient education class. And we also do some preoperative workup, including scopes and things, to look at the stomach to make sure anatomically everything is ready for surgery.
And it really, as we hear all the time, it's a lifestyle change. The surgery is only one part of it.
Absolutely. The surgery is a tool, and that tool can allow us to have our patients lose weight, but you have to be motivated. When you're motivated and use the tool appropriately, fantastic results happen.
So diet and exercise, and you guys monitor all that here?
That's right. I think that one of the cornerstones of our program is really a multidisciplinary approach, where we have not only physicians and nurses, but we have exercise therapists, we have a bariatric nutrition. We have a complete team that's really going to look for the patient in a multidisciplinary approach.
Okay. Now let's delve into a little bit of the recovery time. And once you have been identified as a candidate for this, you sign up and get ready for surgery, do all the tests, and have the surgery. What is the recovery time?
One of the benefits a lot of our patients like about the lap band is it's an outpatient procedure. So the procedure itself takes a little under an hour. You're in the hospital overnight and go home the next day. And then, generally speaking, most patients are able to go back to work in about 2 weeks.
Okay. And once you have the surgery, how do you feel? How does a person feel after that?
Well, most of our patients are quite excited about having this lifestyle change.
Right.
The procedure does not have a lot of pain. The pain would be similar to really a laparoscopic cholecystectomy. So the first 2 weeks they'll feel a little bit of restriction just from the surgery itself, so they'll drink very slowly. We'll start them on clear liquids, but over time they'll be able to add more foods into the diet.
Okay, and in terms of your hunger level, does it affect that, obviously?
That's one of the great things about the lap band. There's a small silastic tube that's going to go across the upper part of your stomach, and that band gives you that feeling of fullness. So a lot of people don't have the hunger pains that they had before, and that band is able to be adjusted over time to limit the amount of food intake.
Oh, that's great. So over time you can eat a little bit more as you move along.
Right, and we'll introduce more foods because initially right after surgery you're going to have a little bit of swelling from the surgery itself, and as that goes away we'll start putting fluid in that band to make that band smaller to allow to make adjustments.
Because also it's an education process, jumping back to the diet and the exercise. We're all sometimes eat junk food and so on, but I guess the whole education process of shopping correctly, making sure that you have things in your cupboard that you need to be eating, and that and so on like that.
Absolutely, like you had mentioned, it's really a lifestyle change. Some of our bands have the opportunity to have internet exposure, and on that internet they'll have different diets. You can put in what you ate, you can find out the calories that you've taken in, And by doing that, as well as seeing the results of the weight loss, it causes more motivation. And the more motivation that you have and the more results you see, people just do fantastic.
You're seeing great success rate with this.
Yes, we are. We are seeing patients really losing weight over a 3-year period. It's almost equivalent to the gastric bypass.
Okay, and then also seeing the blood pressure go down and all of the other side benefits.
And that's really the number one thing, is a healthier person, whether it be getting rid of diabetes or getting rid of hypertension or decreasing your cholesterol. All those things go great in reducing the comorbidities could potentially lead to a premature death.
And I bet it's exciting for you when you see someone with such great success and then they're out there exercising, eating well, and participating in life to a very different degree.
Right. A lot of people feel like they regain their life. They have the opportunity to do exercising, to go out and play with their kids in the yard,
Sure.
to stand up and sit down without having pain, to get into a booth at McDonald's or an airplane seat. All those things make a big difference.
Right, our society's not really geared for that, and unfortunately it's a prejudice that is not fair, but it's there.
Absolutely. Whether sometimes people get discriminated for jobs or just in general, there's a lot of times discrimination against people that are morbidly obese.
Absolutely. Well, this is all exciting, and we appreciate you coming on with us today, Dr. Washington. Your contact information and an appointment information as well.
Yeah, I can be reached at the Pinehurst Surgical Clinic, 295-0882, and my secretary is Eve.
Okay, great to have you today.
Thank you.